For TP53 and myelofibrosis, there is no evidence whatsoever for the transplant setting, but what is also important for the non-transplant setting. So the study that we present here at EHA is the first study ever, and especially in the stem cell transplant setting. We analyzed 46 patients with a TP53 mutation and analyzed their outcome, but also their co-mutation frequency in comparison to patients which haven't had TP53 mutation. And what we first found was that the phenotype and the genotype didn't matter for non-TP53 and TP53, but the outcome was the smell, especially when you consider relapse-free survival. And we digged a little bit deeper into the data, and what we found was that the TP53 patients had more transplant or post-transplant acute myeloid leukemia for myelofibrosis. So this is a really high-risk population we need to be careful about when we do a transplant. And what we also found was that the allele frequency for TP53 really mattered. So allele frequency above 20% was significantly worse in overall survival, but also relapse-free survival for these patients. So it should be considered, taken into consideration when making the decision for a stem cell transplant and being careful to counsel the patient.